prefers to have patient-centered care or
Hi, can you hear me? Can you all hear me?
or
All right, we're about to start now. Invite your friends. We're about to start now. Invite your friends. We're about to start now. Invite your friends. Invite all your colleagues. We're about to start the questions of the week. This is an opportunity for you to earn $10,000. Sorry, 10,000 naira. Okay, let me see those who are online. Please share to your friends. Share to your friends. We're about to begin. We're about to begin. I have just 5 people online. I'm expecting more. Please share it. Okay, let me see those who are ready. 7 people. We're still expecting other people to join. Please tell your friends to join. All right, tell your friends to join. Tell your friends to join. We're about to begin now. We're about to begin. Still expecting more people to join. All right. Okay. We have just 8 people online. I want you to invite more people, please. Don't be selfish. Invite other people. Yeah, we'll begin in the next 5 minutes. We want more people to join. Okay, about to join. We're about to start. Sorry, I'm at a conference. That's why it's a bit rowdy here. Sorry, I'm at a conference. All right. I guess we should begin now. Okay, the first question of the week is as follows. The nurse is preparing to administer spironolactone to a client. After assessing the client, what data indicates the need to withhold the medication? A, potassium level of 5.8 milliequivalent equivalent per liter. B, apical pulse of 58. C, BP of 130/90, and urine output of 30 mils per hour. Why should the nurse withhold the administration of spironolactone? The first to answer it correctly gets 1,000 naira. I'm waiting for answers. The first to get it correctly, the first to get the correct answer. Okay, Abdulrazak says Miss A. Who else? Who else? Taiwo Olamide says A. Okay. Oh, people are saying A. Okay, keep trying. We still have about 20 seconds. We have about 20 seconds. 20 seconds. Keep trying. Oh, Sharif says B. Okay, interesting. Shemilore says D. All right, we have 5 seconds. Yeah, Yinka says C. Now, the answer is actually an A. We know that spironolactone is a potassium-sparing diuretic. It is a potassium-sparing diuretic. So if somebody's potassium level is already 5.8, which is extremely high, which is high, you wouldn't want to spare the diuretic, the potassium. So giving spironolactone is going to be lethal for this patient. You have to withhold it immediately because this patient may go into cardiac arrest. You know the normal potassium level, 3.5 to 5.0, and this is 5.8, which is high, and you wouldn't want to withhold more potassium. Apical pulse of 58, even though it's lower than the normal limit, it's not too low, which doesn't really have any effect on the potassium. And again, most times it is when somebody is using a beta blocker, or you're giving somebody a cardiac glycoside, that you may withhold it if it's less than 60. A BP 130/90 is just elevated and does not have anything to do with spironolactone. Spironolactone will actually bring it down a little bit. So an urine output of 30 ml per hour is an indication for a diuretic. So the only one that you would withhold it is when the potassium level is extremely high. So the winner of this question is Abdulrazak Miriam. Okay. The next one is the nurse is assessing a client with a tentative diagnosis of multiple sclerosis. Which assessment finding would the nurse identify as a characteristic of early signs of multiple sclerosis? Resting tremor, flaccid paralysis, diplopia, and unilateral neglect. I'm expecting responses now. Responses. Yeah, which one would indicate the early sign of multiple sclerosis? Diplopia. Okay. Maramide says A. Okay. Adeyinka says C. Okay. Taiwo says A. Who again? Let's say, okay. Okay. Shemiri says B. Adekunle Abiba says A. Okay. Multiple sclerosis. Yeah, it is an autoimmune disorder. Okay. C. Okumo Preti says C. All right, we'll have 20 seconds more. Let's keep trying. Maybe nobody's saying a D. Who knows? Let's keep trying. Let's keep trying. Okay. All right, 5 seconds more. Everybody has exhausted their responses. All right, the answer is actually a C. A C. For multiple sclerosis, the first sign that you see in patients with multiple sclerosis is diplopia, because of the destruction of the neurons in the eyes. Now, resting tremor is more typical of Parkinsonism. Flaccid paralysis for spinal cord injury, it could be flaccid or spastic. Then unilateral neglect is for somebody with stroke, with a particular side of stroke. So this patient actually would have diplopia as one of the earlier signs of multiple sclerosis. So Adeyinka won this question. I don't know your full name. Your Facebook name says Adeyinka. So maybe you would send me a message later on to tell me your full name. All right, let's do the third one, which says the nurse is obtaining a health history from a client who states he is having pain in his left arm. Which question by the nurse will elicit the most useful response from the client? Does the pain feel like pins and needles in your arm? Does the pain radiate from your neck to your back? Can you describe the pain you are experiencing in your arm? Is the numbness in your arm intermittent or constant? What will be the correct answer? What questions would you ask this patient? Somebody says a C. Adedipupo Julius. Okay, Adekunle Abiba says a C. Okay, Sharif says a C. Okay, Olamide says a C. All right. I think everybody's choosing C, so there's no point waiting. The answer is actually C. Now, you do not give, when you're asking a question, you don't limit it to a particular type of characteristic. You allow the patient to express his or her mind. Can you describe the pain? It is the patient that will tell you, oh, it is like a pain. It's a numbness, it's or like a needle prick or whatever. So you don't give a lead when you're asking a therapeutic question for the patient to express his or her mind. So Adedipupo Julius won this Adedipupo Julius won this. Yeah. Okay. Now the next one is the nurse is assigned to care for a client with acute pancreatitis. What would the nurse anticipate finding during the assessment of the client? A, hypotension, abdominal pain, fever. Sorry, you may type 1 or A, or 2 or B. Use either number or the alphabet. It was a typo error. So what will be the answer for you to anticipate in a client who you are caring for with acute pancreatitis? Somebody is choosing B, okay. Somebody is choosing 4, okay. Yeah, keep trying. Somebody says a B, okay. Keep trying. Yeah. Somebody says a 3, melena, persistent vomiting, hyperactive bowel. Okay. Somebody, Falila Toyitamola says A. Adedipupo says 4. Okay, keep trying. Okay. Adenika says 1. Taiwo says 3. Awesome, you have 3. You have 5 seconds more. So, all right. The answer is actually an A. Now, we'll do what we call elimination method. We'll do what we call elimination method in this case. Now, let's say 2. There may be fever. Fever is correct, but there can be hypoglycemia. When the pancreas is destroyed, when there's acute pancreatitis, the cells of the pancreas are actually going to, be on leave. They're not going to work, which means insulin production will be affected. And when insulin is not being produced, what do you expect? Is it hypoglycemia or hyperglycemia? Of course, it's going to be hyperglycemia. So you wouldn't, expect hypoglycemia. Now, the third option, melena is not related to pancreatitis. Melena is when there's blood in the stool, which shows GI bleed. Persistent vomiting is possible, and hyperactive bowel sound. Maybe or maybe not. It's actually going to be hypoactive instead of hyperactive. It should be hyperactive, but some patients may also have the other side. So, but the presence of melena rules that out. Now, the fourth one, hypoactive bowel sound, which is correct, but then the amylase and lipase, which are pancreatic enzymes, are going to be elevated instead of decreased. So the most appropriate answer is actually hypotension, because this patient is going to have diarrhea. There will be, nausea, vomiting. So blood volume will be reduced, which will also reduce the blood pressure. So the winner of this question is Falilat Oyitamola. Congratulations. Okay, let's see the next one. Yeah, this is select all that applies. Let's see who gets it. Yeah. A nurse knows the clinical manifestations of a client with Addison's disease. That the clinical manifestation of a client with Addison's disease include which of the following? Select all that applies. Nausea, hypothermia, hypertension, hyperpigmentation, hypotension, and then hypernatremia. You can select the ones you think are the exact clinical manifestations of a patient with adrenal insufficiency or Addison's disease. I'm waiting for responses. Waiting for responses. Yeah, nobody's answering. I'm waiting for responses. What are the clinical manifestations? Somebody says EFC. Which one is EFC? EFCC. Okay, EFC, ADC. Okay. Okay, B and E. All right, B and E. DCFA. Okay. CFA. Who else? Keep trying. Who knows? Yeah, it's not really the first person to answer, but the first person to answer the correct option that wins the question. FCA. Okay. Fellow of Chartered Accountants. Ade Busolami says it's Ade ADE. Okay. All right. Let me see who got the questions correctly. Who says ADE? ADE. Who says ADE? That is Ade Busolami says ADE. ADE is actually the right answer. Nausea is present in a patient with adrenal insufficiency, but hypothermia is not a typical clinical manifestations because they do not have enough cortisol. Does not necessarily make them to have hypothermia. It's patients with hypothyroidism that you may expect hypothermia. Hypertension, not likely, especially with hyperthyroidism that you expect hyperthermia, or if it's a problem of pheochromocytoma. But in this patient, it is cortisol. Cortisol is a stress hormone. So one classical manifestation is hyperpigmentation, and then they will end up having hypothermia because the stress hormone is not being produced. So nothing to activate the stress response. So they would rather have hypotension. Now, hyponatremia, it would have been hyponatremia possibly because cortisol also has some characteristics of aldosterone. So it could be hyponatremia, but not hypernatremia, because this patient is having adrenal insufficiency, and it's the adrenal gland that produces aldosterone for sodium retention. So the person that got this answer is Busolami Adefarati. Busolami. All right, the next question is simple. What is a characteristic of hypoglycemia that should alert the nurse to an early insulin reaction? This is simple. So the first to answer it gets the correct, gets the prize. What is the characteristic of hypoglycemia in a patient who is having insulin reaction? Okay. Adekunle Abiba says C. Taiwo says A. Rahman Musa says B. Sherif Rashida says A. Okay, keep trying. Adekunle says C. Adedipupo Julius says B. Ramat Adekunle says B. Okay. We'll have about 15 seconds more. Okay. Adeyinka says B. Abimbola Hashiat says C. Okay. All right. The answer is actually diaphoresis. That's A. That is A. Anytime you are caring for a patient who has hypoglycemia, the first thing that the patient will manifest is sweating, profuse, excessive sweating. That means that the hypoglycemia has actually activated, muscle hyperactivity, and that's why you're sweating. When you're hungry, sometimes you sweat. Yeah. Drowsiness, not likely, because the body needs to compensate for reduced reduced glucose. The body needs to compensate. Severe thirst, no, not really. Now, severe thirst may be a classical sign of, diabetes, especially when the sugar level is high. But this patient is having hypoglycemia, so not necessarily going to have severe thirst. And coma is not the first sign that you see in a patient who is having symptoms of hypoglycemia, even though the patient may go into into coma later, but not the first sign that tells you that this patient is having hypoglycemia. So diaphoresis is correct. And Olamide Taiwo won this question. Ooh, congratulations. Congratulations. All right. The next one will be this. Let me see who gets this question correctly. The first person to answer gets it correctly. A client is scheduled for a routine glycosylated hemoglobin test. What is important for the nurse to tell the client before the test? Drink only water after midnight and come to the clinic early in the morning. Eat a normal breakfast and be at the clinic 2 hours later. Expect to be at the clinic for several hours because of the multiple blood draws, and then come to the clinic at the earliest convenience to have your blood drawn. What is the most appropriate instruction to give this patient? Adekunle says D. Bola Tito says B. Okay, Taiwo says B. Okay, let's see. Okay, Ramat Musa says A. Falila Toyindamola says A. All right. Okay, continue. Do your best. Okumo Pretty says A. Okay, Pretty says B. Abimbola Olayinka says A. All right, the answer is actually a D. The answer is a D. Now, glycosylated hemoglobin tests the amount of hemoglobin, the amount of glucose attached to the hemoglobin over a period of 3 to 4 months. It does not tell you how much sugar the patient has right now, but how much sugar the patient's hemoglobin has accumulated over 3 months. So drinking water the midnight or whatever will not affect the results, because what you eat now does not change the result. It's what has been happening over 3 to 4 months that the patient would see in the glycosylated hemoglobin. Eating a normal breakfast and be at the clinic 2 hours later does not have anything to do. Breakfast does not affect the results. There's no multiple draws. It's just a single draw that the patient you take the blood and send it for laboratory test. So the patient can just come at any time it is convenient. Anytime it is convenient, based on the clinic schedule, and does not have to do with any dietary restrictions. So the answer is actually a D, and Adekunle Habibat won this question. Now, the nurse is performing an assessment on a client who has been receiving long-term steroid therapy. What would the nurse expect to find during the assessment? Fastest fingers first. Jaundice, flank pain, bulging eye, and central obesity. What would the nurse expect to find during assessment in a patient on long-term steroid therapy? Okay, Derry Bigbe says jaundice. Bola Tito says D. Okay, all right. Okay, Rama Musa says A. Okay, Adekunle says D. Adekunle again, another Adekunle says D. Ramat Banjo Adeola says D. Rama Musa changes her mind to C. Agubiade says a D. All right. the truth is that the answer is central obesity. Steroid is a glucocorticoid. It's just like somebody is having Cushing's syndrome. It's a glucocorticoid. When it is administered excessively, it gives the patient too much of glucose. And one major sign is the adipose tissue, the increase in adipose tissues, and then formation of central obesity. Jaundice, steroid does not have anything to do with jaundice because it does not really affect the liver. Flank pain, not necessarily. Budgie eyes is for thyroid or thyrotoxicosis. But central obesity is for people with Cushing's syndrome or where you administer long-term steroid therapy. All right, so Bola Tito, I don't know your full name. You have to reach out later on and tell me your full name for your payment. But congratulations, Bola Tito. You were the first to get the answer correctly. Okay, I think we are almost there. Now, this is I guess the last one. 1, 2, 3, 4, 5, 6, 7, 8. This is the 9th one. A nurse is assessing a client with syndrome of inappropriate ADH. What would you expect to find in their laboratory values? The first to answer this question gets the prize. What would you expect to find in their laboratory values? Syndrome of inappropriate ADH. Okay, Adekunle is saying A. Okay. All right, let's see. Taiwo is saying A. All right. Taiwo is saying A. Adekunle says A. I'm still expecting others to join. Bola Tito says A. Awesome. Abimbola Olayinka says A. Adedipo says C. Shemilore D. Oluwatosin Salam says D. Oyindamola says a C. Badamosi says A. Abdulrazak Miriam says a C. All right, the answer to this question is a C. The answer is a C. Now, in a patient with syndrome of inappropriate ADH, which is just typically the opposite of diabetes insipidus, in this case, the patient is producing excessive ADH, which means the patient is retaining more water. The patient is retaining more water. And when you retain more water, there is high intravascular volume, there is a hemodilution. Sodium concentration is going to reduce. It's going to fall because of dilution. It is when there is severe dehydration that sodium level goes high. So this patient with syndrome of inappropriate ADH, the patient is retaining water. So water dilutes sodium. So it is considered that this patient is going to have hyponatremia. Yeah, serum sodium, this one, 150 milliequilibrium is actually hypernatremia, which is not typical in a patient with syndrome of inappropriate ADH. Now, potassium does not have, SIADH does not have anything to do with potassium. It has actually something to do with potassium, because potassium may actually be high, because if sodium is low, it's also going to shift potassium out of the cells, because potassium is a major, electrolyte inside the cell. So maybe the potassium level will be normal or will be high. So this patient has normal potassium level. So does not have anything to do with SIADH in this case. Now, C, 120 is hyponatremia, which is fine, which is correct. But then what about serum osmolality? Serum osmolality is also going to reduce because of hemodilution. Serum, the blood is not going to be concentrated. Water is retained, so it's going to dilute the water, the blood. So the osmolality will also reduce. Now, serum potassium of 3 may be normal, but then high serum osmolality is not typical of syndrome of inappropriate ADH. So the most appropriate answer is C, which was won by Adedipupo Julius. Now, let us go to the last question. Let's say a client is admitted with a pheochromocytoma. The nurse should carefully assess the client for what? Let me see who gets the answer correctly. The client has just undergone a surgery for pheochromocytoma. What would you assess carefully as a nurse? Let me see the responses. Ramat Musa. A, hypoglycemia, okay. C, Abimbola Hashiat. Okay. Who else? Go ahead. Semilori says a D. Taiwo Olamide says a D. Okay. Oh, Pretty says C. Adeyinka says a C. Ramat Adekunle says a D. Adepupo Julius says a D. Okay. All right. Let me not waste our time. The best answer is actually C. Pheochromocytoma is a tumor from that is located within the adrenal medulla, because adrenal medulla secretes catecholamines. Okay, now catecholamines are the norepinephrine and epinephrine. You know what they do for your flight and fight response. So this patient with pheochromocytoma should be monitored, because when your adrenaline is high, one thing that actually increases is your blood pressure. Hyperglycemia may be if it's both the adrenal medulla and the adrenal cortex, but not hypoglycemia. Now, hypokalemia, not necessarily. It should be hyperkalemia, even if it's the adrenal cortex. Now, the sodium and water retention, not necessarily, because the adrenal medulla does not have much to do with the sodium and water retention. So for pheochromocytoma, it's going to be changes in blood pressure. So the answer is actually C. I was the first person to answer it is Abimbola Hashiat. Let me see, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We have 10 questions already, but I'm going to give a bonus question to anybody who gets this. Okay, I'm seeing it from the chat. I'm seeing it from the chat. Those that said the answer first, I'm seeing it from the chat. Let me see. From my chat, Adedipupo answered first before Ramat Musa. Maybe it's network or something, but from what I can see here, it's Adedipupo Julius for the question 9. I'm sorry. Yeah. All right. This C, magnesium sulfate. Okay. Who else is trying the bonus question? Who else is making an attempt? Okay, C. Okay. C. All right, Rama Musa, get in touch with me. Yeah. C. Abimbola says B. Shemlori says A. Okay. Okay, now the answer is actually a B. Now the problem in this case is after treatment of thyroidectomy, most times, if they are not careful, they may actually remove the parathyroid gland. I know when the parathyroid gland is removed, calcium inabsorption becomes a problem. So this patient is having a problem with calcium absorption. Again, having tetany tells you it's a problem of calcium metabolism. So in this case, what would you replace? You are not replacing potassium because potassium is not a problem, not magnesium, but you are replacing calcium. So calcium chloride is actually the most appropriate answer. All right, everybody, thank you so much for participating in today's. Those that actually participated, please send me a personal message with your account details so I can send you your money. Abdulrazak Miriam, Adeyinka Adedipupo, Falila Toyindamola, Busolami Adefarati, Taiwo Olamide, Adekunle Abibat, Bola Tito, Adedipupo Julius, Abimbola Hashiat, and Abimbola Hashiat again. All right. Thank you very much. We'll be doing this on regular basis every Sunday by the same time. Please tell your friends to participate. You earn and learn. You learn and earn, which is also an advantage. Okay. I'm actually in a very far place. I went for a conference, so I'm about to prepare to go to my home. We'll see next week, hopefully. Okay. Thank you very much, everybody.